Welcome to Easy Medical Notes. Now we will see mitral regurg. Mitral regurg is a backflow of blood from left ventricle to left atrium during systole. Mitral regurg may also be after mitral valvotomy or valvoplasty. Causes of mitral regurg: mitral wall prolapse, dilatation of left ventricle and mitral wall ring, damage to valve, cups and cordae, ischemia or infarction of papillary muscles and myocardial infarction. Clinical features mainly breathlessness, fatigue, edema, ascites, palpitation due to pulmonary congestion, low cardiac output, right heart failure and atrial fibrillation. Signs: atrial fibrillation, displaced apex beat, pansystolic murmur, soft S1, apical S3, crepitations, pulmonary edema, pulmonary pleural effusion, right ventricular heave, raised jugular venous pressure and edema due to pulmonary hypertension, cardiomegaly and atrial dilatation. Investigation similar like pulmonary stenosis, ECG where left atrial hypertrophy, atrial fibrillation, X-ray showing left atrium enlargement, enlargement of left ventricle, venous congestion, pulmonary edema, in 2D echo left atrium, left ventricle dilatation, and Doppler showing regurgitation, cardiac catheterization showing dilated left ventricle and pulmonary hypertension. Management of mitral regurg is diuretics, vasodilatation if there is hypertension, digoxin if atrial fibrillation, and anticoagulants if atrial fibrillation is there, or digoxin or anticoagulants in atrial fibrillation. To summarize, mitral regurgitation is the backflow of blood from left ventricle into left atrium during systole due to incompetence of mitral valve. It is acute and chronic. In acute, there is rupture of cordia tendineae, papillary muscle rupture, infective endocarditis and trauma. In chronic cause, there is rheumatic heart disease, mitral valve prolapse, degeneration of the valve, annular dilatation, that is cardiomyopathy, connective tissue disorder. When there is systole, blood flow is backwards in left atrium in mitral regurg. Then left atrium dilates and the pressure increases, due to which there is volume overload and left ventricular dilates and leading to heart failure, pulmonary congestion and pulmonary hypertension. Clinical features are fatigue, dyspnea on exertion, palpitation, orthopnea, PND, heart failure due to heart failure signs, which is displaced hyperdynamic apex beat, soft S1, pansystolic murmur at apex radiating to axilla, and S3 gallop. In mitral regurg, there are similar symptoms like mitral stenosis with heart failure symptoms. Investigations: ECG, chest X-ray, 2D echo, Doppler, cardiac MRI. And in treatment, vasodilators, diuretics, anticoagulants, and mitral valve repair or replacement. The severity of regurg is measured on regurgitation volume, how much the volume is regurgitated, the fraction of regurgitation, and effectiveness of the orifice area.